So the first step in understanding simulation in healthcare is to understand why do we really need it, and why is it such an important component of healthcare training, any healthcare related training. So when we talk about patient care, it can't really happen without patient safety. And to have a patient safe environment, you need your healthcare providers to be trained. But how do you train them without uh, causing any harm to the patient? Because think about it, whenever anybody learns something, they are bound to make mistakes. And when that mistake happens on a patient, on a real patient, those mistakes cause somebody's life, somebody's health, a lot of things. And that's just not appropriate. That's not something that anybody wants. I don't want myself to be treated by someone who is not trained and who is essentially practicing on me. I don't want that. So to avoid this thing where a new healthcare provider is practicing on a real patient, we kind of insert simulation in the middle. So there's a classroom learning, there's a simulation, and then there's real clinical learning. So this simulation thing in the middle kind of acts as a bridge, or a buffer essentially. It absorbs all those mistakes that are going to happen later on in the clinical environment, and let those mistakes kind of come out, and let the healthcare provider or the trainee get comfortable with those mistakes, understand that it's part of the learning process, and then learn from it and improve eventually to become a better healthcare provider for all of the patients. So, my name is Dr. Aisha Ahmad, and I am a simulation educationist, and I love teaching about simulation.